Hi everyone, we are here in the AAFE Training Center. I am Lauren and we have a very special patient today, Rachel, who works up in membership here. Today we are going to be doing her Botox treatment, which the areas that we usually treat, which we usually generally treat her every 3 months, but we treat her forehead up here, we treat her glabella, so right here between her eyebrows. We do a brow lift on her bilaterally, so you can see those markings. We treat her crow's feet. We also treat her masseters, both her superficial and her deep masseters. And that's more for her orofacial pain, so TMJ, clenching and grinding, which she really gets a lot of relief from that. So we're gonna go ahead and start. Are you ready? Mm-hmm. Okay. So as you can see, I've already marked her up here and we've kind of talked about what a good dosing is for her. And we're just really going in superficially. Is that okay for you? Mm-hmm. All right, we previously did her lips today, so now we're just finishing off her treatment with her Botox treatment. Turn towards me just slightly, perfect. You always want to do your any filler treatment first before you move on to your Botox, just so you don't run the risk of moving that Botox around anywhere. Turn towards me, last few. We mark all the way across the forehead here, just so that we can make sure that we're diffusing the product and we're not getting any specific areas that just remain untreated. That's how we get that spocked eyebrow. I'm just gonna clean up as we go, making sure not to move that product anywhere. That's really what we don't want to avoid, because we can put it in these exact muscles that I want to put at rest. And then if we go and move it with our hands, or if she goes home and touches her face, then we can accidentally put it into muscles that would then affect her smile or affect her eyelid. Those horror stories that you see on the internet. Okay, doing okay? Mm-hmm. All right. We are currently in the process of doing smooth thread treatments on Rachel as well. She has these areas on her lower face that she has just some creasing that she doesn't like, some old scarring, some creasing, and in her nasolabial folds that we're working with smooth threads. So we have been in the middle of a series of 3 of those, which we seem to be getting a pretty good result. Go ahead and close your eyes real tight again for me. Perfect, and relax. Just going for the brow lift here. Perfect. I'm gonna come to the other side real quick and do this brow. Close them again real tight for me. Perfect, relax. And perfect. All right, we'll do your crow's feet now. Doing okay? Mm-hmm. Really superficially. Tell us a little bit about you clenching and grinding your teeth, Rachel. When do you notice a significant difference now that we've been treating your masseters?
Yes, I do. I haven't had any pain since.
Wonderful. Mm-hmm. And did you get headaches before we started?
Yes, I did.
So it can really help decrease that pain. Perfect. Just gonna wipe. Go. And your patients will get those kind of bee sting looking welts, and those will go away in approximately 20 to 30 minutes after your appointment. Go ahead and clench your teeth for me. Perfect. Relax. Good. We'll just go for your deep on this side too. Go ahead and clench your teeth again for me. Perfect. Good. All right, let's get onto the other side. And clench for me. Perfect. A lot of times your patients can feel like kind of a release of tension when you go in to inject those muscles, just because you might be hitting a trigger point or something, so they can get a really good result with these.